and one of our Gen Z candidates. Give it up, Gen Z. Woo!
Thank you very much. Thank you all for having me here, and thank you all for coming out here today. My name is Hamza Nazir. I'm 24 years old, and I'm a second generation Pakistani American. My parents immigrated to the United States in the 90s. I was born and raised in the United States.
May I have your attention, please? The time is 5 o'clock, and the library closes in 30 minutes. If you need call for a ride home, please come to that.
I moved to Georgia around a decade ago, and I'm a graduate of the Georgia High School public high school system, and I also attended Georgia State University. In terms of my background, I've been working as a technology consultant. I've been working to expand Medicaid and Medicare in multiple states. I've also worked with Anthem Healthcare on their Medicaid program in the state of California. When I was considering running, there was a lot of issues that were on my mind, and I had to realize which one was of most importance to me. And amongst those, there were many issues that stood out to me. Number one, not number one, but one of them would be the school voucher program, where we're taking funding from public high schools and then we're giving them over to the private high schools, or private schools, which are completely unaccountable. And another issue was the librarians, which are being dehumanized, and they're being criminalized through the censorship of their books. And another issue that right now, which recently kind of came into the spotlight, is the Tally Trick scandal, which is basically there's this company which is using bribes or modern day corruption to donate money over to the candidates, and then in return for contracts. And now we've known that my opponent, Greg Dolezal, he's currently one of the people who is invested into Tally Tricks and has a great amount of influence into the contracts. But while I was looking for the most important issue for me, it turns out that the issue found me myself. I've had a cousin who's been over for over a year. He's been dealing with mental health issues, and it got to the point where he quit his job. He moved back into his house with his family, with his parents, and he's just been staying at home. And then because the healthcare premiums were too high, his family decided to cancel their insurance, and also because it got to the point that his health condition deteriorated so much that he was hospitalized for a week. And so recently, the very day that in fact that I was qualifying and I was to the state capitol, and that same evening I found out that because the parents were so scared of taking him to the hospital because of the hospital bills, my cousin Waleed, he passed away at the age of 25. And then the very next day I went to his parents' house to mourn their loss and help them plan out for his last rites for his funeral. I helped them out, and we had planned the funeral for the next day, which would be Wednesday. And then I came back on that same evening, Tuesday evening, I came back, and then I got a call from my aunt in New Jersey saying that her daughter had an allergy attack. My aunt, she's handicapped herself, and her youngest daughter, she has severe allergies. And she grew up with her. My mom told my aunt to move in with us when we lived in New York, and because to help her out, because she was handicapped, she wasn't able to take care of her children. And so after moving down here to Georgia, we had them move down here to Georgia with us too. And once they moved down here to Georgia, they realized that they weren't able to get the full healthcare coverage that they needed to be able to get the immunotherapy for her daughter. She ended up moving back to New Jersey about a year ago, and then so for that Tuesday evening, we found out that she had an allergy attack and she was in the hospital, and so we all moved. That same night we all went to New York by road. It was because for us family is very important, and then once we drove there, and for the past 2 weeks I've been at almost 2.5 weeks I've been at the ICU for my little cousin, and unfortunately this past Tuesday she passed away at the age of 11. And so I feel like there's not much that I could have done, but maybe if only we had Medicaid expansion within the state of Georgia, I felt like there's this sense of guilt within me that maybe if we had that, I could have helped them out in some capacity. Maybe I could have helped them find that EpiPen, which my aunt couldn't find because she was handicapped, she had polio. And so that's my main reason, and because I believe that hospitals and the healthcare system should be working to save lives, not to help fill the pockets of the rich.
that's really important, and that is that there are often issues presented at the Capitol that are somewhat like, I don't need my librarians arrested, I think they're just fine and they're good people, but I do need affordable health care for people like your family, and I do understand people being afraid to go to the hospital, so thank you for stepping up to run for that, and I'm curious if you have any specifics on what you think could be done to make healthcare more affordable and accessible for people.
Right, definitely. If we have a Medicaid expansion within the state of Georgia, I was looking at some numbers from the Georgia Policy Institute, and then it was told that we would get around roughly $8 million per day, which we're missing out on because we haven't expanded healthcare within the state of Georgia. And so this is our tax money that's going to the federal to the federal budget for healthcare, that which we aren't getting because we chose not to expand Medicaid. For every dollar that we choose to spend towards Medicaid expansion, we would get $9 more back from the federal tax bracket. Sorry, I'm about to drying up. I'm fasting a little bit. Fasting today, so it's drying up a little. Did I answer your question or? Other questions?
So it's the money that the state government is refusing to take from the federal.
Right, basically. And this is in Georgia alone. This is other states too, I believe. Arkansas was one state that did end up doing the Medicaid expansion, and then within the time that they did expand their Medicaid, the states around it, a lot of hospitals closed, but in Arkansas, none of the schools closed. Do you have time for one last question? Or? Thank you.